Good morning. Good morning. My name is A.J. Allen, and I am one of the co-chairs of this year's AER conference. It's my pleasure to introduce Dr. Wylie Burke as one of the keynote addresses for the conference. Dr. Burke is a professor and former chair of the Department of Bioethics and Humanities at the University of Wisconsin, an adjunct professor of medicine in the Division of Medical Genetics, and a member of the Fred Hutchinson Cancer Research Center. Her work focuses on the ethical and policy implications of genetic information in research, public health, and clinical care. She founded the University of Washington Center for Genomics and Healthcare Equality at University of Washington, and she co-directs the Northwest Alaska Pharmacogenomics Research Network, a partnership involving universities and tribal communities in Alaska, Montana, and Washington. Dr. Burke received her PhD in genetics and an MD from the University of Washington and completed her internal medicine residency training at the University of Washington, where she also was a medical genetics fellow. She is a member of the Institute of Medicine and a past president of the American Society of Human Genetics. And with that, Dr. Burke, thank you.
Thank you very much for that introduction, and I really appreciate the opportunity to be here and to talk to the primer community. I'm going to talk about the issue of diversity in research with a particular emphasis on problems with lack of diversity in genomic research and how we can learn from communities about how we address the issue of diversity and the issue that accompanies it of justice. And so let me just start with some basic data about genomics. Data that says genomics is failing on diversity. What you see in this slide is that the vast majority of data that we currently have in genomics is from European populations. We have very small samplings of data from some other populations. Certain populations, particularly indigenous populations, are notably absent. So what does that really mean? What are the problems or implications of a lack of diversity? It's a problem for science. Lack of diversity means that we lack full knowledge of the range of human genetic variation. And with that, a loss of opportunity for insights, for understanding better the implications of genomics for health. And the lack of diversity is not just a lack of diversity in knowledge about genomics, but also lack of diversity in knowledge about environments. We lack the full range of human population participation, which means we lack both knowledge of genetics and ability to study gene-environment interaction. That latter is really important because most health concerns involve interactions between genes and the environment. That leads in turn to limited basis for the development of new therapeutics, new tests that might, as we hope, improve healthcare through this concept of precision medicine, better abilities to individualize healthcare. And it means that as those benefits come offline, as they come from the research into the clinical care, unless we solve the diversity problem, there'll be fewer benefits for most of the world's population. So what I'm going to suggest is that solving this very significant scientific problem, this scientific problem that leads to injustice, is a need for partnership, a need for researchers to work with communities in order to move forward. So let me just say that as background, that I'm speaking from my experience with the Northwest Alaska Pharmacogenetic Research Network. This is a network I co-direct with my colleague Ken Thummel at the University of Washington. It was launched in 2009, and it has the purpose of understanding pharmacogenomic contributors to drug response. So this is a fundamental component of our hope for the way in which genetics will improve healthcare. We know that individuals vary often dramatically in their response to drugs, and we know that something like 50% of that variation can be attributed to genetic differences, basically differences in how people respond to drugs, how they process them, how they metabolize them. We put together a research network that involves collaboration amongst universities in 4 states in the Northwest and amongst 3 tribal communities, because we hypothesize that if pharmacogenetics is going to be important for improving healthcare, for reducing adverse responses to medications, that it was really important to ensure that we had pharmacogenomic knowledge from all populations in order to ensure that that drug safety opportunity would be available to everyone. And we have in our research now what I would argue is proof of principle that our hypothesis that studying diverse populations matters was correct. What we have now, and this slide is just a snapshot, is research that shows us that in Alaska Native people, there are gene variants that affect their response to a commonly used blood thinner drug, warfarin, that simply are a different profile from any other population that's been studied. And what that means is if you're going to use pharmacogenetics to improve the safety of warfarin, to, for example, limit adverse events like bleeding from this blood thinning drug, you really need to include these alleles when you're providing care to Alaska Native people. We have subsequently also demonstrated that the profile of alleles, the profile of genetic variation affecting drug response differs not just between Alaska Native people and European descended people, but also amongst and across different indigenous populations. So in order to deliver the kind of healthcare in the future that we want to, we really need to ensure inclusiveness, diversity in our research populations. As we've done this research, we've become aware of a very important indicator of mistrust that potentially creates a barrier to achieving the diversity that we hope for. Indigenous communities are very reluctant to submit genomic data to central repositories. There are very few American Indian or Alaska Native data in the National Institutes of Health db-GAP repository, which is a central repository for genomic data, and data sharing requirements that are part of NIH policy have caused tribes to refuse research funding because the compliance with the data sharing represents something that they're uncomfortable with. So we need to understand that. We need to learn from communities where this mistrust comes from. There are a variety of reasons. Tribal communities, as other disadvantaged communities, have experienced stigma and discrimination, some of it deriving from research. They have concern also about the research focus. They're concerned about how their samples will be used. Will the samples, quite aside from the issue of stigma and discrimination, will the samples be used to address questions that are meaningful to the communities? Who decides? Who's in charge? Part of what drives these concerns is a history of research abuses that I expect many of you are familiar with. But just to go through a few examples. One example that lives in Alaska Native memory is is that exposure of Alaska Native people to radioactive iodine, including pregnant and lactating women, without either information or consent. In fact, participants were not made aware that research was going on. There is also the Barrow alcohol study. This is a study in which research on alcohol use in a particular Alaska community was, after the research was completed, widely publicized in a way that was derogatory to the community. And as an illustration of a different kind of research harm than we're commonly used to thinking about, the community actually had a loss in its bond rating. It actually suffered financial harm to its ability to borrow because of a response not related to any financial management on the part of the city, but rather to the way certain research findings were publicized. And then finally, there is the Havasupai case. So let's talk about that. Here are the sequence of events to this widely publicized case. The Havasupai tribe in the Southwest approved diabetes research because diabetes is a major health concern in their community. And this research included the collection of samples for genetic studies. These samples, just to be clear about the IRB issue here, the DNA samples were collected using individual consent forms that did not in themselves specify diabetes research. Tribal members believed themselves to be consenting to diabetes research because that was the only research that had been approved by tribal authorities. There was little yield from the diabetes research, no new findings that could be helpful to the community. However, de-identified samples were stored and shared with other researchers and resulted in research on schizophrenia, on inbreeding, and on population migration. A lawsuit by the Havasupai against Arizona State University, where researchers were located at the time, alleged fraud, negligence, and other violations. Were the Havasupai harmed? Well, if we look at the record, we can say IRB procedures were followed. A non-specific consent form was used. When de-identified samples were created, IRBs reviewed study uses of those samples and did not find any regulatory barrier. But from the Havasupai perspective, there was a significant harm. This is, as you can see from the present slide, disputed. One of the tribal attorneys remembers being told in a mediation meeting with ASU, there's no broken bones, you haven't been harmed. In other words, there was no physical harm to the research subjects. But what they were concerned about was something that went beyond physical harm. Researchers lied to them. They lied to me and I trusted them, and that trust was broken, as one Havasupai member said. Another talks about a feeling of violation. I wanted to better the tribe. Specifically, I wanted my samples to be used for concerns, for health concerns that matter to the tribe, for diabetes research. In fact, tribal members felt that the ways in which other research was used were potentially stigmatizing, particularly the research on schizophrenia and on inbreeding, and also that it was potentially spiritually harmful. And these are the views of research participants that I would argue need to be respected. I would also note, as a quote from a researcher who was not personally involved in this, either in the original research or in the dispute, No matter who's right or wrong, you should not end up in court with your research subjects. Something has clearly gone wrong when that's happened. So let's step back and ask, what are the issues that are at stake here? First of all, de-identification of the Havasupai samples does not protect the tribe. De-identification does not remove a group label. In fact, the samples were still noted to be samples from the Havasupai tribe, which means that any discriminatory effect of research was still present. And of course, the Havasupai tribe had not been asked how they wished the samples to be labeled. There's also the issue of justice, fair distribution of burdens and benefits of research. One of the reasons that tribes insist upon oversight of any research that occurs on tribal lands is that they wish to ensure potential for community benefit from research. They wish to ensure that any burdens of research are balanced, as our regulations require, by a potential for the community to derive benefit. Finally, I would say there's a very fundamental issue at stake in the Havasupai case, and that is our bedrock commitment to voluntariness in research. Again, non-specific consent forms were used in this particular sequence of events, but there was a clear understanding on the part of tribal authorities and on the part of tribal members who signed those consent forms that the research they were consenting for was the research that had been reviewed and approved by the tribe. So I think we can argue that the bedrock of voluntariness, that is assuring that individuals are informed before they consent to participate in research, was not upheld in this case. So I now want to talk about a meeting and what we, my colleagues and I, learned from this meeting that was held by our research network. This was some years ago, and discussion of this meeting still continues in our network. We're still refining the lessons that came out of this meeting. We called this the Exploring Pathways to Trust meeting. It was a meeting that was sponsored by our research network. It was attended by our research partners, including research colleagues based in universities, but also community tribal members, including tribal leaders, and also representatives of the National Institutes of Health and scholars from tribal communities. And one of the things we sought to understand in this meeting was what tribal perspectives on data sharing are. If there is mistrust of, for example, putting data into federal repositories, then how can tribes help us to think about data sharing? And from there, how can they help us to think about responsible research? So, first of all, what we learned is that there is strong support for efficient research aimed at translating knowledge to benefit. There's a good understanding that that will include data sharing as part of research efficiency, and that should happen. However, there are caveats. Benefits of research are often poorly defined. They may be indirect. They may be long-term compared to more immediate potential harms, such as those harms of stigma that are particularly salient for small, readily identifiable groups. And further, data sharing policies fall under a trust relationship with the federal government, which means there has to be meaningful consultation. There has to be government-to-government consultation about the application of data sharing policies to tribal communities. But fundamentally, what that also is invoking is tribal sovereignty. Tribal sovereignty means that tribes have the power to exert oversight over research that occurs in their communities. And what are the goals of that research oversight? Well, first and foremost, of course, tribal communities are concerned to prevent research abuses and group harm, no more exposure to radiation without even letting people know that's what you're doing, no more reporting in an irresponsible way that could stigmatize and harm the community. But what we heard from tribal leaders and what we continue to hear in our discussions with tribal leaders is that there is another benefit, there's another important goal. Once we move beyond preventing research harms, what we're interested in doing is assuring that questions are relevant to the community, that there is potential for community benefit from the research. That doesn't necessarily mean short-term benefit. It could be long-term benefit. It could be benefit that helps children or grandchildren. But research should have a pathway to benefit, and communities are interested in talking with researchers about what that pathway might be. And then finally, we are talking about research communities where resources are often limited. And when researchers come into communities, they require help from the community that draws on those resources. And so as researchers, as communities consider research participation, they have to consider wise use of community resources. What these points speak to is a public stake in research. And I want to now expand that point. I've explained to you a particular stake that tribal communities have in research based on their past history, based on the fact that they're small, identifiable communities with limited resources. But they are also calling attention to a stake in research that affects the public at large. After all, the public funds a lot of research. The public funds scientific training. So even when researchers go off into the private realm, for example, in drug companies, and to research under those auspices, the public has trained them. And so the public has a significant stake in research, in how it's done and what questions it addresses. It has an interest, in other words, in research procedures that ensure justice and ensure respect for persons, as we know from the IRB structure. But it also has a stake in the translation of knowledge gained from research into societal benefit. It has a stake in knowing how we think about that, knowing what the pathway to benefit is, and judging research according to its potential to realize that pathway. Let me just say then that the issues that we hear in American Indian and Alaska Native communities are certainly not unique to them. The potential for stigma or the related harms apply to other marginalized groups. They could be defined by race or ethnicity. They could be defined by health status, for example. So these issues are of concern more broadly. And the lack of focus on relevant research and on community benefit, concerns about those areas apply to all research across the board. So as we try and sum up what are the implications, and in particular, as we think about what the implications are for thinking about research planning and considering research review as an IRB would do it, we have to ask two questions. One of them is a question about accountability. Is there sufficient attention to these concerns in research planning and review? Are the research studies that come before the IRB studies that show evidence that these issues have been attended to? And there's an issue of participation. Do research teams, or for that matter, do institutions, do IRBs seek community input? Of course, IRBs have a community member. Is that sufficient? Should there be a broader input about what the implications of different kinds of research are? I would argue that this is something we have to think seriously about. I would say there's another particular lesson for IRBs that comes from our experience working with tribal communities, and that is a need for more IRB focus on group harm. We will note that this is not a harm that is specifically addressed in the Belmont report or necessarily included in beneficence, respect for persons, or justice, the three principles that drive IRB review. I think you can find it there if you look for it, but it isn't explicitly called out. Arguably, it's particularly relevant for groups that have been disadvantaged or suffered discrimination in the past. It is precisely those groups who are most vulnerable to group harm from research or other activities. As Emmanuel and Wager have suggested, we should perhaps consider a fourth principle for research review, which they call respect for communities. And they identify a couple of components there: obligation to respect the values and interests of the community, wherever possible, protect the community from harm, as well as individual research participants. And it's important here, again, to note that tribal sovereignty gives tribal communities a legal basis for insisting upon attention to these issues when research occurs in tribal lands. But this principle applies arguably across the board. It would certainly apply, for example, to research involving urban Indians, where tribal sovereignty does not hold sway, or, as I've said, to other marginalized groups. Are there other considerations for IRB review? I think that IRB review should consider evidence for community review of research plans. This is obviously going to be particularly acute concern when we're talking about research with tribal communities or other communities that have been disadvantaged or marginalized in the past. It's not unreasonable, though, to ask, to what extent are we broadly seeking community review of research? What methods are in place for deliberation or consultation or other evidence of partnership? For example, if a hospital is creating a data bank or supporting research that involves a learning healthcare system or routine use of data derived from healthcare, what kind of methods might we propose or expect to find for the community of patients that hospital serves? And finally, as we think more deeply about community participation in research review, what kind of plans are in place for informing the community of research outcomes? I'm going to propose that all of these factors are a part of the process that ensures a better environment for inclusion, a more trustworthy environment that will enable communities to feel more comfortable, but also a way to think more broadly about the research agenda and our responsibilities to the public. I think what I'm saying here and I'm going to wind up with this slide, is that what tribal communities have taught us about inclusion and justice is that we need to envision a different approach to research, one that keeps all of our safeguards in place, of course, but adds to that governance procedures that include community review, research priorities that are determined by both scientific opportunities and community priorities, and prospective discussion of strategies to enhance community input and participation in research. So I'm going to end there, and I look forward to your questions and discussion. Thank you.
Thank you, Dr. Burke. We have several questions to begin with. The first of these is, do tribal groups have their own IRBs? And if not, could that be part of the solution? IRB members would have to come from within the group. For example, 4 of the 5 members would have to be affiliated with the tribe. Or was this something that's been present in the past and somehow it just was skewed or misused?
Well, I think there's been tremendous development of IRBs within tribal communities or serving tribal communities. So the Indian Health Service has instantiated IHS IRBs that serve that purpose, and larger tribal communities have developed their own IRBs. The Navajo Nation, for example, has its own IRB. In Alaska, there's the Alaska Area IRB that serves tribal communities in Alaska. Many smaller tribal communities really don't have the resources to maintain their own IRB. They will often now contract with IHS. I think there's room for further development, but it's very important to distinguish between IRB review and tribal governance review. So it's important to have these developments in IRB review, and I think they're an important part of progress moving forward. But tribes often require a review of a research study as to whether they'll even consider having that research occur in their jurisdiction. And they attend to things that aren't necessarily formally part of IRB review. So for example, tribes will want to review research to determine whether it fits within their priorities, whether it's an appropriate use of their resources, whatever might be required from them. And that really has to do with research agenda that may extend beyond explicit IRB review. So both are important. One of the things researchers need to do when they think about working with particular tribal communities is inform themselves of what kind of procedures will be required.
Thank you. I think it's important what you were just commenting on in terms of the fact that research actually extends beyond the elements of a clinical trial, and certainly in my area, which is in the pharmaceutical industry, we often have programs that are many years in the course during which there may be a number of trials, but I think to your point, it sounds like one of the things we should think about is, particularly when those programs are touching on something of relevant to the Native American communities and others, that we need to get that input early on and then kind of continually throughout the process. And I guess kind of following up on this question about the IRB, are there programs? I mean, that seems like that's part of what your program is intended to try and do.
Well, are there programs to forward this kind of dialogue?
Well, to support that ongoing dialogue during the course of a research, whether it's industry or academic or whatever, where there may be a number of studies being conducted.
Yes, I think probably the most important thing I can point to is a tremendous growth in leadership on the part of a new generation of American Indian and Alaska Native scholars who are providing scholarship that includes conceptualizing how to proceed with research, but are also themselves engaged in the research. I think I can answer that question at two levels. One is the level of national discussion, and I think we'll find in the scientific literature a lot of vibrant discussion about what does it mean to be trustworthy, what does it mean to be respectful, and then there's what I would call nuts and bolts, a particular study, a particular community, and there what I think matters for university-based or pharmaceutical-based researchers is to approach communities with an open mind and a willingness to listen, to first of all listen and hear perspectives from the community as to what they would consider trustworthy procedures.
Okay, thank you. We have another question here, which is, has there been research done that is similar to the Exploring Pathways meeting that you had that investigates the attitudes towards research from the American Indian, Alaska Natives who are traditional in their spiritual beliefs, whose education is more experience-based rather than Western academic-based? So really set more in the native culture as opposed to in the Western academic culture, and whose jobs do not involve engagement with health research or researchers. This individual hypothesizes that this is the larger percentage of potential research participants, and their attitudes towards research may be substantially different from the other group.
I think it's often said there are 500 different tribal nations in the United States, and there's tremendous variation across those. I can speak primarily from personal experience. I can only speak to health research. And obviously health research is only going to happen if a community is interested in pursuing that kind of health research. There may be other communities who would not be interested in that kind of research, and I think that's a given. But what I think, and I suspect there are two things that this questioner is getting at. The first is, all a researcher can do really is approach a community and engage in open-ended discussion. Out of that discussion may come ideas for research, and those ideas for research may be based on Western science, or they may be based on indigenous knowledge, or on some combination of the two. The other point is really that point about indigenous knowledge. Tribal communities have deep knowledge based on their longstanding experience. As one Western researcher said, local knowledge is always superior to the knowledge of a researcher coming in from the outside, and that local knowledge can be crucial to identifying even what questions matter, what questions should be pursued, and then how they should be pursued. So I think responsible and trustworthy research certainly includes, as we have done, bringing a particular genomic research model in for discussion and determining whether or not that is of interest to tribal communities, but it also includes open-ended discussion where tribal communities may actually bring even more innovative ideas to the table.
Thank you. Next question gets a little bit more into IRB regulations and trying to apply them in this setting. So the common rule specifies that the IRB should not consider possible long-range effects of applying knowledge gained in the research. For example, the possible effects of the research on public policy as among those research risks that fall within the purview of IRB responsibility. And this could be seen as conflicting with the considerations of group harms that you mentioned, especially for stigmatized communities when reviewing studies. So do you have any suggestions or recommendations on how IRBs navigate this when reviewing federally funded studies?
Well, that's an interesting question. I think I would argue that group harm, I agree there are long-range issues, but there are potentially short-range issues. So I think the potential for data produced by a study to produce or to augment or in any way worsen group harm, I think does have to be considered. It has to be in the thoughts of the researchers, of the IRB members who are reviewing research. But I think this question points to why tribal communities separate governance review from IRB review. The question points to the fact that IRB review is a specific entity. It has a specific set of concerns that it's addressing. Again, I would argue group harm, it can be included, but it isn't addressing necessarily some of the long-term issues. It isn't addressing necessarily a community's health priorities or other perspectives the community may bring to the value of research. Okay, what does that mean for IRB review? What it means, I think, is that certainly with tribal research, IRB should be looking for evidence that there was attention to governance review, that there's evidence that researchers are aware of the requirements of that community and have complied with the requirements of that community. That can be evidenced by procedures that are reported, by letters of support that are provided, that kind of thing. And if we push that a little bit further out to communities who don't have sovereignty, let's say a disadvantaged community in an urban setting, I think you could ask the same question in terms of letters of support or evidence of a community advisory board or things of that kind.
Okay, thank you. So this is a little different line, which is how do we facilitate community education to ensure that a community has good understanding to make responsible decisions?
So interesting question, because one of the conversations we've had a lot in our research partnership is this idea of capacity development. And I just want to, before directly answering the question, I want to note capacity development is a two-way street. There's a whole lot of capacity development that has to happen on the part of the university-based researchers, some of which we've been just talking about here. But yes, our partners certainly are very concerned to be able to engage in conversation about research procedures, about research goals, about priorities in pursuing research goals. And one of the things that we've engaged in as a network is educational workshops for our members. There's a wonderful program called Genetics Education for Native Americans, or GINA, and we have held, I think now, a total of 3 workshops as part of our research undertaking. This is also the moment perhaps to talk about the importance of training as part of a research enterprise. So our network, our whole network, includes interns for students, it includes postdoctoral fellowships, it includes training for junior faculty, including researchers in tribal locations, and all of that is an important component of capacity development.
Okay, thank you. I'm glad you mentioned that these sorts of education issues are two-way, because I think oftentimes there's so much discussion about health literacy and such, and we're sort of assuming that we know everything that the community needs to know, but there's a lot that I think we need to know as well. So I'm very glad you mentioned that. We have another question, which is somewhat related to an earlier one, but I think is worth coming back to given our audience, which is what should non-tribal IRBs consider when reviewing research? that members of the tribal communities will be, or that involves members of the tribal communities being involved in it?
Well, so that's a complex question, but I think the first point is again one we've already alluded to, which is I think the IRB should look at what kind of community consultation occurred, what kind of community input occurred. Now, we might be talking about maybe a hospital-based study that's going to enroll everyone with a particular diagnosis, and that will include people who might be Native American. And that's a somewhat different situation than a situation in which you're going into a tribal community. On the other hand, there is concern, I think, about how are those participants identified, how specifically are they identified, and what kind of community consultation should occur amongst local tribal leadership to ensure that recruitment procedures and identifiers applied to samples are appropriate. So I think even in that situation, some degree of community consultation is appropriate. What I would also say is a real red flag is a situation where, for example, people might be interested in diverse samples, including American Indian or Alaska Native samples. And so they recruit from facilities that serve urban Indian patients without any consultation with the facility. And that would be a red flag. I think even though tribal sovereignty doesn't apply, consultation with the clinic, consultation, making sure that recruitment procedures are appropriate, asking the clinic governance what kind of feedback, what kind of return on results the community is looking for, those things are important.
Okay. This next question is getting a little beyond the tribal communities, but I think is something that also occurred to me during the presentation you made. And that's how well do the lessons of tribal oversight and input in human subjects research translate to other marginalized groups? Tribal groups are somewhat unique in that they're organized political entities. You have mentioned the concept of sovereignty a number of times. That clearly has some representatives that are identified that can speak for the group and such. That isn't the case. It certainly isn't always the case. I think in some cases there may be situations where it is, but it isn't the case always for Black, Latinx, Asian, and other communities.
Yes, and I would say for me, that is one of the major lessons of the experience I've had, which is if you work with a tribal community, you have a democratic governance that can speak for the community with whom you're working. It is empowered to do so, but the issues they are concerned about are exactly the same issues that other marginalized communities are concerned about. The same issues of trustworthiness, the same issues of reluctance toward data sharing, et cetera. And what that means is that researchers have to be open to developing cooperative approaches to working with those communities. Many communities are let me say a number of communities are already a bit ahead of the researcher in the sense of already having community organizations that can support the creation of community advisory boards. And I think it's a responsibility of the researcher to find that out, to seek out such organizations. And if those organizations don't occur, to seek meaningful dialogue in the community. To ask people in the community, who can speak for you? Is there a group that could help us to provide an advisory board? We'd like the community to have an advisory board that looks over the research. Who should we work with? I think this is essential.
Okay. We have another question, which is what protections are in place for research on de-identified data or I think de-identified specimens, which does not go through IRB review?
Well, that's a problem, isn't it?
And I think maybe secondary, what you focused on particularly was secondary use of those samples in research, but the same could be said of data.
Yeah. I think this is a major hole, a major gap in our oversight, and really it speaks exactly to the mistrust of data sharing. This is the concern for a historically disadvantaged community. The idea that your samples might go off into the ether and get used for whatever, you know, as one tribal leader said, we're not really interested in doing research to build your CV. We're interested in research that gets to useful outcomes.
Okay. How should potential conflicts between respect for community and respect for individuals be navigated? For instance, when a community majority might oppose a genetic type study, but individual or individuals consent to research that could result in generalizations to the broader group. That's especially true, especially if the tribe may not be specifically targeted in the research.
Well, I think this is a complicated question, and I'm going to talk about it first from a tribal perspective and then expand it. So I think it's important to remember that tribal communities have democratically elected governments. So the community has elected government, and when the government determines that a particular type of research should not occur in its jurisdiction, that's a democratic decision. Although we can talk about potential conflict, I've certainly never encountered that myself. That is to say, individuals who live in that community want a democratically elected government, and they appreciate that government making those decisions. Certainly, if you take it the other way around, once a democratically elected government has said, yes, this research can go forward, they still want individuals to have the opportunity to consent or not consent. They don't determine that individuals will therefore participate. So there's a lot of respect for individual choice there. Now, once you get away from a democratically elected government, you no longer have I guess what I would say is governmental procedures that determine what is legal or not legal in a particular jurisdiction. There is no way for a tribal government to prevent a member who lives in New York City from participating in research that occurs in New York City on the basis of an individual consent. What I think is, so we're now talking about ethics, not about legal requirements. And what I think is ethically responsible in that circumstance is to make efforts to let people know what you're doing. Let local tribal organizations know what you're doing, seek their input, and ask them if they have any concerns. If research is worth doing, it can be justified. And hopefully that conversation will be productive. But trying to do things under the radar and not seeking feedback or input is, I would say, irresponsible.
Okay. This is somewhat along the going the other way in terms of group or community versus individuals, but this is going from, the next question is, in your discussions about tribal communities and about the implications of genomic research, have you encountered concerns about research findings being overgeneralized from Native American patients? And in particular, this person is thinking about the practice of, for example, saying that you know, with a given drug or something like that, you have to make a certain adjustment for the Native American population, and by implication, that's for all Native Americans, even though there are 500 different nations across the U.S. and a variety of environmental factors and differences between those nations, and who knows whether it's generalizable or not.
Yes, that speaks to a very important scientific point. In fact, our own data show us that there is diversity across different tribal communities, exactly as you would expect. I mean, the genetic diversity of human populations is highly complex. And what that says is we shouldn't be adjusting drugs by race. To the extent that we're going to use genetics as a contributor to adjusting, what we really need is to get to the right kinds of pharmacogenetic testing, i.e. inclusive testing. I mean, we know that even within a population where the prevalence of a particular genetic trait that dictates a certain drug response, where the prevalence is more common in one population than another, we're still going to see variation within that population. Some people have the variant, some people don't. So yes, we know that human genetic diversity is highly complex. And as we think about using that information, we have to, or doing research to use that information, we have to be attentive.
Okay. What do you advise for tribal groups and urban Indian organizations who are finding academic researchers ignoring the principles of data sovereignty and carrying on with their research pursuits without permission consultation? Is this one of those situations where, for your one slide, the people being studied and the investigators are going to end up in court, and that's probably not a good thing?
Well, I'm guessing we won't. Probably people won't end up in court as much as perhaps they should. But I would say if tribal communities are having that experience, there are two things that need to happen. One of them is it needs to be publicized. It needs to be talked about. But the other is, in most university communities, there are potential allies, and I think, and I'd like to think that IRBs in a given institution might be able to identify who those allies are and help connect community members who are concerned to allies within the community to then brainstorm how can we bring these loose cannons under control, because that's what needs to happen.
Yeah. Well, and it has negative impact for all researchers in that area.
Exactly.
One last question here, and this is a little bit more specific, but this is from someone who worked at Gallaudet College as a research fellow some years ago, and was aware of the ethical issues of disclosing potentially negative group level differences and the need for potential benefits, direct or otherwise, in working with that community. And this person had a deaf research assistant who helped in that regard. And a common response was this, or fear of this community, was that outsiders, hearing people, researchers, would take from the community and not be concerned about what they could give back. And so this is benefits to the community type of discussion that you've been highlighting. Their question was, are you aware of genomic research contrasting or comparing the native deaf community to the hearing world in the Native American population, I think is what they're asking about.
Yes, well, that's a very good question, and I don't know the answer. I'm not aware of specific points of view on the part of deaf American Indians or Alaska Native people. But I think the question and the point just underscores, actually, I think these are shared concerns. In other words, the concerns that this individual heard at Gallaudet are very parallel. And so I'd expect those concerns to be very coordinated, I guess, very similar.
Thank you. And thank you for your talk, and we'll turn it back over to Mary Ellen.
Thank you very much.
Thank you both. Thank you, AJ. Thank you, Dr. Burke, for a wonderful talk this morning, and many comments in the chat thanking you for the time to answer questions this morning. And yes, we appreciate your time. We know you were up early with us this morning, so thank you so much for a great discussion, and thanks for everybody's participation this morning. I did put in the chat that our next general session starts at 11:30 a.m. Eastern Time, and that's on subjects consenting versus consenting subjects. So we hope you'll join us for that session. And then then after that, we have breakout sessions and afternoon networking sessions. So make sure you check back to the online platform to see what we have up next. And for the remainder of the day, a reminder, you will get a conference evaluation for this week. You'll get that at the end of the day tomorrow. And again, we just want to thank Dr. Burke for a wonderful talk this morning, and we hope everybody has a great rest of the day. Thanks everybody so much. Bye now.